Hi, just came back from Korea and I wanted to talk, before I forget, about all the skincare treatments I got. My name is Dr. Roy Kim. I'm a board-certified plastic surgeon in San Francisco and Beverly Hills, and I was able to get skincare treatments. This is the real deal. Yes, I'm a plastic surgeon, and I enjoy getting skincare treatments in Korea because sometimes it's actually, weirdly enough, a lower price than what I can do, and there are certain things that are available in Korea that don't exist in the United States. So I went to the HEV Dermatology Clinic. It's in Incheon, which is a small town, or maybe medium-sized town, right outside of Seoul, and that's where the airport's located. I was able to see my good friend, Dr. Shin, and she was kind enough to do my treatment. So of course we had a consultation and I got 3 things. The first thing I got was Ultherapy, known as Ulthera. It does exist in the United States, and what it does is that it really heats up or delivers energy underneath the skin to the SMAS, the SMAS. So as you know, SMAS stands for Submusculoaponeurotic System, very fancy term for the really strong fascial structure that supports the face, supports the soft tissue. And as a facelift surgeon, I use this to actually tighten up facial structures underneath the skin. The Ultherapy device really heats it up or delivers energy, so it gets hot, tightens up. Having said that, as a surgeon, it doesn't really tighten things up that much. As a non-surgeon, and it is a non-surgical procedure with no incisions, yes, you can see a result. You can see a difference. Now, it's only been 3 days since my procedure, so I don't really see much of a difference yet. Now, having said that, when I really tighten up and make funny expressions like this, or move my mouth around, I still feel the tightness even though the procedure was done 3 days ago. Ultherapy/Ulthera does get a bad rap in most of the world because the feeling among facelift surgeons is that it can scar tissue, which means that the SMAS gets a little scarred, feels a little thin, is harder to pull, doesn't support as well when I do a facelift. Having said that, I agree with those sentiments, but I do think that this really only exists in people who are bad candidates or have had Ulthera a lot. In other words, maybe twice a year, maybe for many years. As a reminder, this is only my second procedure in like 14 months. And I am a better candidate in my opinion because I'm a male, because I'm an Asian male. In other words, I have thicker dermis and collagen than the average person. Plus, I'm a little overweight. So specifically, I do have some facial fat and a slight double chin to a large double chin, depending on who you want to believe. In my opinion, those factors help because even though the energy and heat are delivered, there is a chance that some of my facial fat may be affected as opposed to the SMAS. In terms of pain control, I've been told and read that this is one of the more painful non-invasive procedures out there. I'll be honest, it doesn't really hurt me that much. The first round, which is delivered deeper, hurts maybe 3 out of 10 pain. And the second round, which is more shallow, and it should hurt less, except you've already had it heated up and it already hurts. For me, it hurts about 6 or 7 out of 10 pain. So it does hurt more, but again, something that is totally bearable with just numbing medication. Now, the second treatment I got was actually very painful, and it was skin booster. So as you may know, I've made other videos, I'll point it out right here, where skin booster is some type of compound that's actually delivered just underneath your skin. I can do it manually or I can do it with a device. Now in Korea, they do have cooler devices, so I thought it'd be faster, more efficient, and it is. I was also told that according to the marketing, it should hurt less. Well, Dr. Shin explained to me that that's marketing, it's not true, and that it does hurt. It hurts as much as doing it manually. I chose JuveLook, which is PDL A HA. The HA is easy, it's just hyaluronic acid. We know it as Juvederm, Restylane, a couple other brand names in the United States. The PDLA component is a variant of PLLA. So PLLA is also known as Sculptra in the United States. PDLLA is a very similar chemical compound. Dr. Shin explained to me that it is actually a smaller physical particle. So it's actually able to be delivered correctly underneath the skin and not form nodules or bumps, which is a known risk for regular Sculptra or PLLA in the United States. So despite the fact that I had numbing cream, really it hurt a lot. So when I got the injections, it was pretty fast. I got 40, 50 shots in the space of, let's say, 5 to 7 minutes because the machine is so much faster than doing it manually. The problem was that the pain was literally 8 out of 10 pain. It was very painful. And I can understand why Korean patients don't really love it. Before we bring it to the US market, I do think that patients need to be educated that it's a relatively painful thing. Manual is slower, hurts as much. A machine is faster, it's more efficient. still hurts about the same amount. I thought the machine would hurt less, but I was wrong. The third and final procedure I got was Botulax, which is known as Letybo, a Botox equivalent or competitor, into the masseter muscles and underneath the jawline for a slight Nefertiti lift. So in case you don't know, the masseter muscles are here. When you clench, they get wider. And since I have a whitish / square face, if you inject it here, it looks a little more narrow. Also, a Nefertiti lift is a known way to give Botox, where you give it sort of in the neck bands or underneath the jawline. It relaxes the muscle so your neck looks a little longer and you look a little more elegant, if you will, regarding the neck and jawline area. What's interesting is that I did get that done in Korea, and yes, I paid retail price. The retail price in Korea is less than what I can get Letybo or Botox in Dysport, whatever wholesale in the United States. And mind you, I'm a plastic surgeon. So it's crazy to me that I can pay retail pricing to my friend and her wholesale price is quite low, and this is what she would normally charge her patients. I can't purchase it in the US for that low of a price. So it's totally nuts, but that's just the way it is. The nice thing in Korea is that you sort of get an overall holistic approach. So specifically, I had the consultation. I got a facial, which cleaned everything very well. I got numbing medication, very strong topical numbing medicine. It was left on for about 20-30 minutes. And then I had my 3 procedures. After I was done, I was then able to get another facial, which was more of a cooling facial and a quick red light treatment to help reduce any inflammation or swelling. And then I was out of there. The other unique thing that I did for this treatment was I only requested local numbing medicine. What I found out is that typically most patients are going to get local numbing medicine and IV something. So the IV medications vary, depends on the clinic, depends on what you feel comfortable with. Of course, it depends on patient preference. But these IV medications are pretty strong, and so they make you drowsy and less anxious automatically. We have the same medications in the United States. It's just that typically we would not give those medications for these treatments. Typically, I think we would prefer to either do it in the operating room setting to be monitored, and also maybe by pill form. Sometimes I do also opt to inject directly into the face to numb up the nerves of the face so you have a lot less feeling. There is a different legal requirement in Korea versus the US. In Korea, if you get IV sedation, if you get some stuff in your IV, you're allowed as a patient to just leave. You don't need another person to take you out of the clinic. Of course, they prefer that, but legally they're not required to. And if the patient doesn't want it, the patient doesn't have to do it. To my knowledge, in the United States, pretty much every state, I cannot give you deep sedation and then discharge you. You can't get some procedure like a root canal or this dermatology procedure or whatever with sedation and then be expected to just leave. You can't take public transportation, you can't take a cab, you can't take an Uber or Lyft. You have to have a person responsible for you, be in the waiting room, and then take you home. So the overall costs are typically 25 to 50% of what's available in the United States. I've talked about this a lot in the past, but essentially the cost of doing business in Korea is lower. The legal concerns, the liability concerns are lower. In other words, malpractice insurance, business insurance, all that stuff. And finally, since there are so many competitors that the Korean government has allowed, they have multiple options for Ultherapy equivalent, Botox or Botox equivalent, even skin boosters. We simply do not have a lot of these options available in the United States, for better or for worse, because the FDA has not approved them. Since we have fewer options for, let's say, lasers or Botox equivalent, or for skin booster, or for the machine that delivers skin booster, the costs are elevated in the US. Would I do it again? Of course. I went there last year and I went again this year. I look forward to being a more sexy Dr. Roy Kim in about a week or two. You can see my results on social media. If you have any questions about what I had, please let me know. And as always, thanks so much for watching.